This is a demonstration of the interior health capabilities of capturing and reporting on data for the clinical practice standards for the operating rooms in interior health. We've created an app we use. This app allows us to, offline, does not need Wi-Fi access, but allows us to do data capturing in the operating rooms to allow us to capture the data and upload it into a central database where we allow the report writing. So the app allows us to choose whichever date. The current date auto-populates. We can choose any site we'd like within interior health. I'm going to use Kelowna General Hospital just for example. And within that we can also drill down to which operating room in that hospital we choose to. I'm just going to choose number 3. And for the most part, a lot of it is just a simple yes/no question. You just tick a check mark. That means it's a yes, it's followed. And these go along all clinical practice standards that do exist in interior health. These are standards that are developed with the clinicians and including the physicians and nurses that are involved in keeping the clinical practice standards up to date. Again, for the most part, a lot of them just are yes or no. There are a few questions that are some not applicable or not always indicated. So such as flashing, words are flashing, done yes, no, or not applicable. And because there is no flashing in this instance I'm using, we'll just say not applicable. And that does also show up. This is used to validate all of our clinical practice standards in interior health. And again, like I said, it allows us to then go ahead and create a spreadsheet on how well we're doing for the compliance with these audits. From there, we can actually either email this to ourselves for a PDF version of how we've done. And we can also upload the submission, which goes again to that central database we were talking about. And that allows us to dump it into what's called a Tableau report. And for that Tableau report allows us to show the reporting system. I'll show you the Tableau report now. So this is an example of our Tableau report that exists for interior health. Again, up on the top left, we can pick whichever facility we want. I've de-identified it for the purposes of this. But you can pick, say, number 12, for example. You can see how the data does change. And I'm going to go back to all, and you'll see how the data does change again. We can pick whichever year. This is data for 2012. And again, you can pick whichever month you want if you want to drill down to exactly what month you want. But the idea for the purpose of this audit, or this demonstration, we'll be able to show some significant practice standards that do help with our initiatives going on in interior health. So looking at hair removal outside the operating room, overall in interior health, 78% is happening outside the operating room. Proper skin prep, again, appropriate skin prep, normothermia, antibiotic timing is crucial. The checklist, the 3 phases of the checklist, and then for overall compliance of the checklist. You can see on the bottom the trend line, the checklist compliance. This is overall for interior health, which is a summary of this box here. Gives us an indicator of how well we're doing with compliance of all three of the phases of the checklist. And the nice thing is it shows us a quality indicator that in the places like in May, where we have the dip in use of the checklist, there's also a dip in the antibiotic timing compliance, as well as September, October, November, and December's climbing back up. But the nice thing about this is it shows the validity of the data to when the checklist is not used. That's when our antibiotics are not given on time. So this is shown to all of our operating room managers throughout interior health, is taken to all the quality meetings throughout interior health, and is also shared through our surgical council for them to make improvements on as well. If you have any questions, please don't hesitate. This video is created by Jeff Sherbeck and Ben Raybergen, and please feel free to ask any questions you see that fit.